Red for a reason, of course. That's our big campaign, Rally for Red.
That's right. You know what? It's the 15th, and you know what that means. It's our Rally for Red Day, and that means it's all about heart health, and it's all about you. And today, Dr. John Bishai, who is a Mayo Clinic Cardiologist, is joining us to talk to us about something that I think most of us have experienced at one point in time or another, and I'm talking about heart palpitations. And Dr. Bishai, I feel like I've experienced this before, and I would describe it as kind of a fluttering sensation. Is that a good thing?
Well, you're describing palpitations pretty much how most patients describe them. So it's there's a number of words that they use to describe this irregularity that occurs in their heart. They call them palpitations, they call them skip beats, they call them fluttering.
A big chest pounding?
A very hard pounding. And also it just could be just something that's very rapid. These things can be fleeting, or they can last for hours, or they can come and go.
Okay, so let's talk about, those are some of the symptoms that are described to you. Are some of them worse than that?
They can be, and what we worry about the symptoms associated with the palpitations.
Okay.
So if they're fleeting and they go away within a few seconds, probably not much to worry about.
Okay.
It's when they're continuous and they're associated with dizziness or not feeling well or even feeling like you're going to pass out. That is when we become a little bit more concerned.
Okay. What causes them to begin with?
There's a number of triggers that can trigger palpitations just in normal individuals. Caffeine, as you were just talking about.
Maybe you don't want that fourth cup of coffee
Right.
this morning,
Exactly.
right? That'll do it.
Caffeine, alcohol the next day after drinking maybe a couple bottles of wine. Exercise can do it. But we also need to know whether or not patients have any underlying heart disease.
Okay, which is the trigger, which is exactly why you're here, because there are chances that there is something a lot more serious going on. Somebody comes into your office and they describe that they're having some of these symptoms. How do you treat them?
Well, what we do initially is a diagnostic workup. We want to know what the status of the heart is. So we always look at the plumbing first. We want to make sure that
Okay, I like that.
there's no blockages.
Okay.
If they have a history of blockages or heart attacks, then we get a little bit more nervous about these types of irregularities and fast beats. We also want to know about the heart function itself, making sure that the heart function, the squeeze is good, that the valves are good, and that everything else is in check.
So if there's something that needs to be treated, perhaps you could start with medication. It could go even further than that as you move along and find something that underlying that could be a little bit more serious. You have some of the, I'm going to call them tools, if you will, to help people who have something a little bit more serious. What is this one right here? If you could just hold, I'm going to hold that one up. Whoops,
sure.
Just a little bit, yeah.
So when we have patients who have the symptoms, we need the objective data now to correlate with the subjective symptoms. So
Okay.
these monitors are placed on patients, and they are able to press a button when they get their symptoms, and it'll actually record their heartbeat.
And that helps you later, right?
Exactly.
And what is this one for?
This is a 24-hour continuous monitor, so we can
Okay.
place that on for 24 hours. This one we place for 30 days, and they can just press the button when they actually get their symptoms.
So let's say it goes beyond that. It's a serious problem that needs to be addressed and perhaps needs some surgery, some minor surgery. You take this particular tool right here, which is fascinating to me. I don't want to show that just yet. Thank you. You take this tool right here that's fascinating to me, and you go in and you actually map out the heart, right?
That's correct.
This is amazing. Can you operate this little apparatus right here? Because this thing moves around and it literally goes in, and you can watch how he can move. He's moving the end of this with his control in his hand. And this helps you map out the heart. Now I want to see those pictures. And Dr. Bishai, this is exactly what you need when it's a little bit more serious, and this helps you fix the problem.
Exactly.
Okay.
So patients may have short circuits in the heart where we need to find that focus, and we can use that with this catheter.
So here's the deal. You know what? If you're experiencing some of those symptoms that Dr. Bishai was just telling you about, then you need to go in and find out what that problem is. Let me give you some information. You can schedule an appointment with a Mayo Clinic Cardiologist by calling 480-301-8200. Learn more at mayoclinic.org. Okay, guess what? We want to keep you heart healthy. ABC 15 We team up with Mayo Clinic for our Rally for Red campaign. Each and every month, we're going to send you easy-to-follow recipes and ideas to help keep you and your loved one's heart healthy. To learn more, get our Rally for Red reminders. Sign up at abc15.com/rallyforred.